Hi, ONA members. I'm Linda Haslam Stroud, and I'm president of the Ontario Nurses Association. And I wanted to provide you a quick update on the hospital contract negotiations on behalf of your elected Hospital Central negotiating team and your chair, Catherine Hoy. We have just spent 2 days in arbitration, and I'm really discouraged to have to tell you that the employer's presentation at this arbitration hearing did nothing to provide your team members any hope that the employer and/or the Ontario Hospital Association value us as registered nurses, practical nurses, nurse practitioners, and allied health professionals in the hospital sector. The employer put forward proposals that, first of all, wages, pretty well nothing, benefits, nothing, and basically put forward regressive concessionary proposals on our layoffs and our job posting provisions of our collective agreement. In essence, the employer is looking to basically be able to deem any job as temporary and would basically really eliminate the option for us to even have a position posted in the future with the kind of language that they put forward. I have to tell you that we provided a full response to these very regressive proposals. And we are hoping that this arbitration board that will be making the decision will not be listening to this kind of rhetoric that the hospitals have put forward. On the other hand, we, as your elected team, have put forward your priorities. Your priorities in relation to a moratorium on RN cuts, violence language, which, by the way, the employer is arguing that we aren't even supposed to discuss violence at the central table, unfortunately. And we're also talking about our workloads, some reasonable wages, and benefit improvements. We're also looking for a nurse practitioner provincial-wide pay scale. Those are just some of our proposals that we've put forward. We will be providing a full report back to you, but I wanted you to know that your elected team gave it their best. We spent 3 weeks at a negotiating table where we agreed on 30 items with the employer. And guess what? Those 30 items were basically housekeeping changes. There was nothing in those 30 proposals that substantially would improve or even affect you in your workplace. This employer actually presented, if you can believe it, to an arbitration board saying, we agreed on 30 of the ONA's proposals during bargaining. 30 proposals we agreed to. They didn't agree to one of ours. Well, guess what? The 30 proposals were housekeeping changes. We changed the word the to a. We put a period in a different spot. We updated different letters of understanding. Nothing that wasn't your basic normative housekeeping changes. And they had the gall to say to our arbitrator that we somehow had 30 proposals agreed to of ours and none of theirs. And you know what this employer put forward during bargaining? Why we wouldn't agree to their proposals? Would you agree to reduce the new grad rate by 3%? Would you agree to slow down your wage step progression and add another step in the middle of the grid so that everyone would take longer to get improved wages? Would you agree to the gutting of our benefits? Would you agree to amend our sick plan? Would you agree to give up our right to recall, to job security, to our positions? Would you give up the right to have a job posting where we can compete and hopefully move into a job that we're interested in? These are the kind of regressive tactics that this employer has put forward. And this isn't in the name of balancing any budgets. This is in the name in trying to crush the RN workforce. So I'm a little angry. But I want you to know that we have completed 2 days of arbitration. We are providing some additional comments to the arbitration board. And I believe that the arbitrator has figured out what this story is really about. The story is about 60,000 RNs in the hospital sector, as well as nurse practitioners, practical nurses that we represent in the hospital sector, trying to provide quality care each and every day. It's pretty simple. We want our jobs to stop being cut. We want reasonable workloads so that we can provide quality care. We want to be free from violence and being beaten up. And we want to have some normative wages and benefit improvements. Things that respect us for the value we provide. So stay tuned. We will continue fighting on your behalf, and we will provide you a full report back on the proposals that were put forward. So look to the ONA website for that information in the coming days. Thanks for your attention, and ONA is strong. We're united, we're professional, and we aren't going to give up. Thank you.